This conference will now be recorded.
Devices. JETT company is a global provider of unique patented direct current plasma devices and professional dermocosmetics. What is important is that we are right now present in more than 65 countries all over the world, and this means that we not only are quite a huge company that we are able to sell to many countries, but as well we have many experiences from many customers, many clients, and many doctors all around the world. So we have experiences with Afro-Americans, with Europeans, with Asians, with Africans, with different types of Fritz-Patrick scale skin, with different types of healing, different types of immune reaction. So we are able to, during the training or once you start to use our device and once you come to any issue, we are able to solve it, because not only we in a company, but many of our co-doctors has many experiences and many ways how to solve any problem or an issue. We were founded in 1991, and our JETT brand is used since 2000. The most important part of our history was year 2013, when we developed JETT Plasma Lift device. This was just for beauticians, just for dermatocosmetics. But in 2015, we have developed JETT Plasma Lift Medical, and we started with our patent decision and patent sessions and certificate sessions, and this is how it looks like, our device that is called JETT Plasma Lift Medical. We are able to produce it in two colors, in white or black, and device itself comes with 5 applicators. As you can see, there are 4 silver applicators that are used for esthetician use, for beautician use, for cosmetic use, and 1 golden tip that is used for professional medical use. All treatments with silver tips are non-invasive. The treatment with golden tip is invasive, and is the part of it is ablation and coagulation. As well with JETT Plasma Lift Medical, there is some issue with my presentation. We have developed JETT Serum Lift Vital, that is supportive product for our market and as well for our devices. It's a product for beautician use with combination with silver tips and silver heads, and it consists of hyaluronic acid, lactic acid, vitamin C, panthenol, and a mixture of more vitamins. In 2018, we spread into ophthalmology, to professional ophthalmology field in medical way of meaning, and in 2020 we have spread into very new part, that is gynecology field. But in all fields we are focused in medical and in aesthetic way of treatment. What you can see now on the picture is our plasma pen, that is as an extra for basic device, and mainly is used by ophthalmologists, but as well you can order it to basic device if you would like. And this is how looks our brand new device that is called JETT Plasma Lift 3 watts, that is for use in gynecology field. We are present in all social media, so if you would like to find out more information, and not only from a company, but as well from our clients, from our distributors, or from our customers, you may find out under hashtag JETT Plasma or JETT in Instagram, in Facebook, and as well you may find out many YouTube videos from our company, but as well from our clients, according to treatment and according how the patient looked like before and after the treatment. But as well we are going to show you some videos today. And now we are going to talk a little bit about the blepharoplasty with jet plasma lift medical. Why blepharoplasty? Because approximately 80% of usage of our device is based on blepharoplasty. This is the most used indication all around the world. And this is something, our treatment and our protocol is something that nobody has. There are some important things. First important thing, our spot is very, very small, our active spot. You may see the discharge between the tip and the skin. The distance between the tip and the skin is about ½ centimeter, so the device is completely contactless. And you may see the ending of the discharge is about 0.1 millimeter wide. So with this device, you may be very, very precise and create very small collateral damage if you don't want to create collateral damage and you want to focus only in dermis. Second thing is that we are able to set fluently energy in our device in 8 levels in output energy 0 to 1.8 watts. So you can comply to your customer, to needs of your customer, and you are able to use the setting of level, the setting of energy that is the most appropriate. And on the left side, you may see that because our plasmatic discharge is ½ centimeter, or our tip is ½ centimeter far from the skin, because discharge, the length of discharge is about ½ centimeter. You in real time, you see what you do and what damage or what coagulation you are creating. So the plasmatic discharge is always going where you would like. And this is very important thing that you may, by your eye in real time, control what you do and where you do it. Now I'm going to explain you how our device works, because I think that the understand of usage of device is not about indications and photos of before and after, but the most important is how the device works, because once you know how the device works, you know how to use it. Our device, as I have explained you and mentioned, our device is the only device worldwide that uses direct current. Direct current means that we need grounding electrode for patient, because electric energy in our device and in body is flowing in one circle, in one direction. In our device, it is said that the end of the device, the tip, is negative and the grounding electrode is positive. So this is the difference that creates plasmatic discharge between the negative and positive pole, and flowing of electric energy is, as it is shown in picture, from the tip of the device into the skin by plasmatic discharge. There, the plasmatic discharge has thermal activity, and flow of electric energy is coming back into electrode and coming back to device. The polarity of this is very important. I will explain you when to use it and when it's good to know that polarity may help you in treatment, that no other of our competitors is able to use it. Because all of our competitors, they don't use direct current and they use alternating current. Now I switched into another slide, and you may see that there is a red block, and that this red block in skin means way of coagulation of our device. When we use direct current, polarity of minus at the tip and plus or positive at electrode, the flowing of electric energy is creating plasmatic discharge. This plasmatic discharge has active spot, as I have mentioned you, on the skin, and this active spot has thermal activity. The specification, the very, very specific thing of direct current and direct current plasmatic discharge is that the coagulation that is created in skin, in dermis and epidermis is not round shape but vertical shape. As you can see on our picture, the way of coagulation or the shape of coagulation is vertical. That's why we call it vertical burn, vertical oriented coagulation. All our competitors, just to explain you why we are very specific, I'm going to explain you how works our competitors. All our competitors, they use alternating current. This means that they don't have one single plasmatic discharge as we do, but they have many plasmatic discharges. But this is quite counterproductive. Once you use many discharges in one time, you create big collateral damage. The shape of coagulation that you are able to create with alternating current device is round shape, as you can see on this picture. And once you use round shape of coagulation, you need higher energy and you create more collateral damage. If we compare it with our device, once you use our JETT plasma lift medical that use direct current, and this is very crucial, plasmatic discharge creates vertical shape of burn. Orange line at the bottom means dermis. The very important part of blepharoplasty is retraction of dermis. If you are a plastic surgeon or oculoplastic surgeon or ophthalmologist and you provide surgical blepharoplasty, you cut off the excess of the skin. If you would like to provide non-invasive blepharoplasty, it's quite important that you cannot cut off anything. You need just to push skin to retract. And the way how you push skin into retraction is very important. In our device, we use plasmatic discharge, and this plasmatic discharge creates vertical shape of burn, vertical coagulation. And once this coagulation reaches dermis, it starts remodelation dermis because it hurt dermis, and dermis need to heal itself. And by this healing of dermis, you start retraction in the point where you create coagulation. As well, alternating current devices are able to create coagulation, but because they create from the surface, they create round shape of coagulation, they create more collateral damage till they reach dermis in depth. So in a final way, comparison between our device and alternating current devices is that in time of same effect in dermis, in time of same damage in dermis, you are able to create less collateral damage in epidermis. And this is very important. And I will show you in pictures in blepharoplasty how do we heal, how our clients heal during healing period. And you may compare if healing is faster or not as our competitors. Our another competitors are another devices like laser or electrocautery. I have said that our device has very small active point. Very small active point means that end of plasmatic discharge is only 0.1 millimeter wide. And you may compare in real skin the smallest point that I was able to create by electrocautery on left. It was about 1 millimeter. By my erbium laser, the minimum focus that I was able to create with the erbium laser was 0.3 millimeter. And JETT plasma lift medical in the middle, where you can see that it is the smallest point of coagulation on epidermis. This is the smallest collateral damage, but depth is the same. Depth is able to reach dermis. And this is very important in usage of our device, that we create very small collateral damage in epidermis, but according to depth, it's the same as our competitors. This technology could be used in these indications like blepharoplasty, skin imperfections, vascular lesions, and rejuvenation. But in each indication, we use quite different protocol and quite different treatment. And I'm going to show you in steps how we provide blepharoplasty, then how we destroy skin imperfections, and at the end, I'm going to explain you how we do rejuvenation of the skin. Who is most suitable for non-invasive blepharoplasty? This is quite important because good indication of client, well-indicated client is 1/3 of good treatment, good healing, and client satisfaction. So who is the most indicated or most appropriate for non-invasive blepharoplasty? It's somebody between those two phases. Somebody, let's say, between 35 to 55 to 60, mild or moderate blepharochalasis, superficial mimic wrinkles that are not fixed yet up to this mass, up to the muscles, and somebody that healing of the skin and retraction potential of the skin has quite good. If somebody is really indicated for surgical blepharoplasty, it is not a very good client for non-invasive blepharoplasty. But what is very important that we are able to give some treatment into clients that would like to have done something with their upper eyelids, but they are still not indicated for surgical blepharoplasty. Way of treatment and way of indication of our device may compare it to erbium or CO2 blepharoplasty laser. Area that is indicated for this treatment is upper eyelid, lower eyelid, and as well lateral part. You may treat it all, or you may treat it only part, or you may treat only crowfeet areas. It's absolutely up to you, because treatment of our device is not rigid. It's very flexible, up to needs of patient and up to needs of you as a provider. Now I'm going to show you some patients that are indicated for blepharoplasty. I'm going to make a commentary for which areas. Well, this client is indicated for non-invasive blepharoplasty by JETT Plasma Lift Medical on upper eyelid. You may see skin fold that we may expect that is going to retract. You may see on right picture the skin fold that is covering about 2/3 of upper eyelid, and as well we may treat with JETT Plasma Lift Medical lower eyelid, because there are some mimic wrinkles and there is some laxity of the skin, and we may expect the retraction of this laxity, the retraction of this bump, and very firm skin on lower eyelid. As well, we may use JETT Plasma Lift Medical for destroying this verruca on left picture, literally from lateral angle of eye. Let's go to another patient. In this patient, we may expect a retraction of skin fold, but in exactly in this patient, we may offer to this client at least 2 treatments with JETT Plasma Lift Medical, not only single treatment, because she will need more retraction of upper eyelid, of this fold of upper eyelid. But as well, we may offer to her crowfeet area and as well lower eyelid, because there is a lot of small mimic wrinkles, and as well in crowfeet areas, we may very easily to start with rejuvenation. Martin Martin didn't tell you that during all the time, if you have any question, you may set your question into chat in a written form, and I will explain all your questions. There is one order to share screen. Martin, are you here, please?
Yes, of course. I'm here. I can see your screen, so
you can see. Okay, so it's okay.
Yeah, I can see it all the time properly. I just saw the question also, or the chat also, but I don't see any issue.
Okay, that's good. This was my in medias res question. Thank you. So once back into presentation, in this plan we may expect a retraction of upper eyelid and get rid of a lower eyelid wrinkles, and as well area of crowfeets. What is important, it's always question if this treatment is painful. Yes, this patient can feel pain because, as I have explained to you, there is a flow of electric energy in one direction, and direct current is more painful than alternating. What it means? It means that you need to use some way of anesthesia, and type of anesthesia is absolutely up to you. You may use injection form of anesthesia or cream form of anesthesia. There are some differences between them. If you use injection, it is fast, it is exact, and works very well for non-invasive blepharoplasty, but creates more swelling. It's faster with more swelling. It's up to you. And there's still little risk that you are create small hematomas. I will show you in other pictures. Or you may use a cream form of anesthesia. It's quite for longer time, because you need to wait at least 20 or 30 minutes to get effect of cream anesthesia, and it is suitable only for countries that has on market creams with higher percentage of anesthetic inside. For example, in Czech we've got only 5% EMLA, and 5% EMLA is not very suitable for this. So this is up to you if you choose injection or cream type of anesthesia, but you need to know about pros and cons according to this. And our treatment consists of two parts in the same time in one treatment, but two parts of one treatment. First type of treatment is called scanning. What we call scanning is fast movement through all treated area with fast movements with jet plasma lift medical to create very superficial burn, and this burn will lead to resurfacing and peeling of effect. If we look on epidermis and dermis, and we do fast movements through all eyelid with jet plasma lift medical, we create superficial burn, and this superficial burn in 3 or 4 days will go to peeling off effect and will be basis of resurfacing. This changing of depth of epidermis is going to help to get rid of very small mimic wrinkles. At the end of resurfacing, the patient in real time looks like this. You may see a resurfacing has been done on lower eyelids. Scanning has been done on lower eyelids, and at the end of the scanning and the end of the first part of treatment, patient looks like this. The area is red because of erythema, because of superficial burn, not vertical shape oriented burn, only very, very superficial burn caused by scanning. And this how patient looks like right after the scanning. And after this, we postpone to second step of our treatment. And second step of our treatment is something that we call dot by dot technology or dotting part. And dotting part means that we create a lot of small vertically oriented coagulation spots. For all treated area, we create small spots of coagulated tissue. And because each one is able to reach up to the dermis, because depth of penetration of coagulation of our plasmatic discharge is 0.5 millimeter in periorbital area in upper and lower eyelids, we are able to reach the depth of half of dermis. Because we use vertically oriented coagulation, we do not create collateral damage. So there is not going to be damage on all epidermis. No all epidermis is going to be in one crust or eschar, only small spots, but the same spot as on the surface, on the top, is going to be coagulated in dermis, in depth of dermis. And this is very important because if we use a lot of small coagulated dots, they will heal spontaneously, they will remove spontaneously, and each one spot is going to shrink. Each one spot of vertically oriented coagulation is going to close, and by closing of these coagulated spots, this is the effect of non-invasive blepharoplasty, of shrinking. Because if you are going to heal only one spot, nothing is going to happen. But if you create for all area that you would like to treat many small spots of coagulation, each one is going to shrink and all area is going to retract. And this is very important up to final effect of non-invasive blepharoplasty. This is how patient looks like. Meanwhile, in creation of dots, you may see that we cover all eyelid with these small dots, one next to each other. All of them, they are in distance about 1 or 2 millimeters far from each other. And all upper eyelid, we are going to cover by this dots. Now I'm going to ask Martin, I'm going to switch presentation to video because I would like to show you how treatment is providing, and then I'm going to show you in pictures how patient looks like after treatment and what is healing period and how the patient looks like. So Martin, please, I'm going to stop sharing of my screen.
Yes, can you already see my screen?
Yes.
Great. So I will play the video, and if you could comment on it, would be nice.
Definitely. Hope for everybody the video is going to be okay. So first step of treatment is scanning. Scanning means that we provide fast movements for all area that we would like to treat. These fast movements deliver correct energy and deliver amount of energy into all area. This fast movements is going to create superficial burn. We may explain it's like first grade of burn in a depth of first level of burn, and this superficial burn will lead to peeling off effect. By fast movement, we try to deliver, or we deliver the same amount of energy to all area. It means All area where you would like to start retraction, all area you need to have resurfated. That's why we do this scanning part or this fast movement to all area. In upper eyelid, it means that we may go from eyebrow up to the edge of eye, and this is the correct point or correct areas. And now this is the second part of treatment, and this second part of treatment is dotting. You may see that we go out and in, but still we are half centimeter far from the skin, half centimeter above skin. So in real time, you can see what you do. In real time, you can see how big coagulation you create, and you stop with creating dots as soon as you see small black spot, because small black spot means that there is vertically oriented coagulation. And by these dots, you cover all area that you would like to treat. Again, a safety area is from eyebrow to the half centimeter far from the edge of eye. You cannot reach up to the edge of eye, because if you do ordinary in all edge of eye small dots, you may destroy by heat, you may destroy cartilage inside. So that's why the safety area is half centimeter from the edge of eye, half centimeter from the angle, and up to the eyebrow. The same treatment for upper eyelids or for lower eyelids you do for both eyes, but because you may in real time correct what you do, you may see and you can make correction with what you do. If somebody has some irregularities between right and left side, you may be very, very flexible and do even different treatment between left or right eye. Okay, Martin, thank you so much for this video.
Yes, of course. And I will stop sharing my screen so that you can go on with your presentation.
And now I'm going to show you, after this type of treatment, how patient looks like. So after dotting and scanning, or after scanning and dotting, patient looks like this. You may see redness or erythema on upper and lower eyelid. This is because scanning has been done there. This scanning creates superficial burn, and this superficial burn appears as redness. This redness is not long lasting. It's about for 2 or 3 hours, because very soon this effect will lead to peeling off. And you can see as well small dots of coagulated tissue, and this is after dotting part. You cannot see dots on all eyelid, but this doesn't mean that it hasn't been done. Dots has been done for all upper eyelid and all lower eyelid, but at the end of the treatment, you wipe area with disinfection. With disinfection, you may remove small parts of coagulated tissue. That's why it is not as visible, but still there are spots of coagulated tissue up to the dermis. Because we destroyed upper part of epidermis, so we create epidermis thinner, and there is more penetration of UV radiation up to the dermis and up to the melanocyte cells. It is very important to use in post-treatment care period. It is very important to use UV sunscreen, UV sunblock. It could be in a makeup or it could be used separately, like cream and then makeup, but you need to use it. You need to use it after treatment. This is another patient, how it looks like right after treatment or immediately after treatment. And what you can see on the left lower eyelid is what I have mentioned in part of which anesthesia to use. You may see that there is a small hematoma, and this hematoma could happen if you use injectable form of anesthesia, but it is not long-lasting hematoma. It stays inside maybe 3, 4, 5 days, not longer. So, and it's completely makeable. So you can put makeup on it and get rid of this. And this how patient looks right after. It is not all. Patient is going to swell more. There will be more swelling at the second and third day of treatment. You may compare upper picture and lower picture. Between those are 24 hours between those two pictures. And on upper picture, you see only a little of swelling, but on lower picture, you may see a lot of swelling. And this swelling is something that will happen at the second day, and you need to explain it to your client because she or he need to expect this, not to get it as some complication or side effect, but get it as a normal part of healing process. But after a few days, it will disappear. And after 2 or 3 days, it will disappear. And I will show you complete line of photos how patient heal. But first of all, I would like to show you what are final results. Here has been done treatment of lower eyelid and crowfeet area. You may compare lower eyelid and crowfeet area. There is a lot of retraction of the skin. We don't have any more bumps of skin laxity on lower eyelid, and as well many of mimic wrinkles or all of mimic wrinkles are gone. What we still may see are 2 or 3 deep wrinkles that were fixed up to the muscle, up to this muscle. So we are unable to destroy them, but we may, by retraction of the skin and reservation, we may really improve visage of all area. Again, another picture before and after. We may see retraction of upper eyelid. Again, retraction of upper eyelid, but as well retraction of lower eyelid. You may see this picture is 1 year after treatment. So this treatment is long lasting. You don't need to repeat it, let's say 3 or 4 times in a year. You may do it once in 2 or 3 years and it still lasts. On this picture, you may see treatment of upper eyelid, lower eyelid, and as well crowfeet area. Very nice retraction of fold on upper eyelid, very nice treatment of crowfeet area and get rid of mimic wrinkles, and as well on lower eyelid. Another picture, you may from front visual, you may compare retraction of upper eyelid, and what you can or what you may compare is that lower eyelids hasn't been done, and this client I think is still indicated to lower eyelid blepharoplasty. Now I'm going to show you complete line of photos. Complete line how healing looks like when you do the treatment on patient. Here has been done blepharoplasty of upper eyelid, scanning and dotting. And as well, you may see that there has been done scanning on lower eyelid. So what we want to do or what we want to provide is retraction of upper fold on upper eyelid and resurfacing of mimic wrinkles and quite laxity of skin on lower eyelid. Right after treatment, you see only very small of swelling, only very small of erythema. But once you proceed to the first day after treatment, as I have explained you, there is a lot of swelling comparing with first day, but this is normal. This is normal part of healing. This lasts only 1 or 2 days after treatment. And you may see in this part that there is swelling, and there are visible small dots of coagulated tissue on upper eyelid, as well on lower eyelid, only in lines around wrinkles. But on the second day after treatment, swelling is almost gone. You may compare it on in first 24 hours, patient has a lot of swelling, but it will very, very soon will go away, and the peeling off effect and the retraction effect will start. This is the third day after treatment, and you may see the starting of peeling off effect. You may see the starting of peeling on upper and lower eyelid. And 1 week after treatment, almost all healing is done. You may see that area has been completely resurfated, and as well you may see that almost no of coagulated dots are visible. Here you may see that only very small points of remnants of coagulated tissue are present, and this is condition 9 months after treatment. After all healing and whole retraction has been finished, you may compare upper eyelids, retraction of upper eyelids, and as well resurfacing of lower eyelids. It's a very nice effect without scarring, without long healing period, because the healing of acute part is about 3 or 4 days. This is treatment that you may provide before weekend, like in Thursday or Friday. Stay at home during weekend, and on Monday go back to work, and nobody is going to find out that some aesthetic treatment has been done. Resurfacing part, peeling off effect, and dots are completely makeable. You can put makeup on it, and our client can put makeup on it, and can go in the 3 or 4 days back to normal work. If you compare it with surgical blepharoplasty, when you need about 7 to 10 days to remove stitches, or if you compare it to laser blepharoplasty, when you need to wait all resurfacing time, this is really very fast and very good healing with JETT Plasma Lift Medical. And not only blepharoplasty, you may treat or you may provide with our device, but the same effect of retraction and resurfacing of area you may use in other areas of body, or mainly on face. This is picture how you may use JETT Plasma Lift Medical for resurfacing and retraction of smoker lines or mouth lines, vertical mouth lines. The same treatment, the same protocol. It means scanning and dotting, because upper lip has thicker dermis and thicker epidermis. There is less of swelling, and you may see on lower picture on right side, 1 month after the treatment, the visage of all area is much better. We get rid of small wrinkles. Of course, deep wrinkles that are fixed to the muscles, they are still present, but very superficial wrinkles, they have disappeared, and all area is resurfated. As well as another patient for treatment of smoker lines and mouth lines. You may see that in 48 hours, peeling off effect start. In 5 days or in 1 week, peeling off is almost done, and as well the removing of coagulated part is almost done. And after 10 days, everything is completely healed, and but the retraction of the skin still goes on, and we need to wait at least 3 weeks after treatment to see final effect of retraction of the skin. Normal questions are about hypertrophic scarring and fillers and Botox and pigmentations. According to hypertrophic scarring, because we do not cut all dermis, we penetrate only to the middle part of dermis, there is a very small risk of creation of fibroblasts and myofibroblasts and creating hypertrophic scar or keloid. But if patient is suspicious of keloid healing, of course, this treatment is contraindicated. This is as well in our training manual, that if somebody is suspicious of creating of keloid scars, this treatment is contraindicated. But if not, if somebody is not suspicious, there is very, very small risk of creating of a hypertrophic or keloid scar, because normally if you treat with our device correctly, there is very small or no creation of myofibroblasts that are responsible of keloid scarring. According to fillers and Botox, main effect of our device is thermal effect, is coagulation that is based on thermal effect of plasmatic discharge. This means that if you have in a skin molecule that is thermolabile, that is not stable in high temperature, you may destroy this molecule by our plasmatic discharge. So need to be very careful. If patient has in place that you would like to treat has Botox or filler, it is contraindicated to do our treatment. But if you would like to combine treatment with fillers and with Botox, with JETT plasma treatment, it is very easy to do first of all JETT plasma treatment and then to do filler or Botox, and this is completely safe. And according to dark pigmented skin, as I have mentioned to you, we are present in more than 65 countries. It means that we have many experiences, even with the dark or different types of skin than European type. Device is very safe, but definitely if you provide restoration and some coagulation, melanocyte cells are more visible. That's why if you use this device, and it doesn't matter if it is in more pigmented or less pigmented skin, you need to keep UV post-treatment protocol as a prevention of hyperpigmentation. So this was about blepharoplasty treatment, and now I'm going to shortly explain you how to provide treatment with our device in different indications. These different indications are skin imperfections and vascular lesions. What is important is that this is not the most of usage of our device, because you may use even cheaper devices for this type of treatments. But once you have JETT plasma vehicle, you may treat as well this type of disorders, of skin disorders. So how to make it with this device? It's very important once we are going to destroy something on body, because our product is medical device, so we may use it in medical indications to destroying skin disorders, and that's why you need to do it in sterile conditions. So you need to do as first disinfection, then put inside local anesthesia, then remove it by coagulation, and then provide again disinfection. Treatment of skin disorders is very easy, and you may use it for first of all scars. You may do shaving of scars. You may shave scars for improving of visage. You may see on left side before and right side after treatment. You may see the improving of visage of scar by the same technology. Same technology means sorry. Same technology means scanning and dotting. So the same technology is used for blepharoplasty, used for improving of scars. Because we use direct current. Direct currents means that electric energy, the flowing of electric energy is best in tissues that contains a lot of water. So this means it is very good for hemangiomas, because hemangioma is full of blood and it attracts flowing of electric energy. So once you start to destroy hemangioma with plasmatic discharge, with our plasmatic discharge, direct current discharge, you destroy not only hemangioma, but as well supply vessel inside. So this is important that there is no recurrence of hemangioma if you treat with JETT plasma lift medical. As well, you may use it for removing of fibromas. You just coagulate it and let for spontaneous healing. Because our effective spot is very, very small, very, very tiny and very precise. As well, you may use it for very small and very precise areas where you don't want to create collateral damage, but you need to destroy something in a very sensitive area, like in between lashes. Our device do not create any radiation or any hurting radiation like UV radiation and so on. So you do not need to use some shields or covers for eye bulb if you would like to destroy something at the edge of eye, because there is no risk of destroying of cornea or destroying of sclera. That's why you may only put inside small amount of local anesthesia and then destroy it up to the in between lashes. You may see on before and after picture that even on an area where verruca has been present, we have destroyed the verruca, and after complete healing, we didn't destroy eyelashes; they are still present in the area. So we destroyed the pathological lesion, but we do not destroy follicles in surrounding of the lesion. So this is really how we do not create collateral damage, because we do not destroy collateral tissue. And another indication that is very, very easy to use by or easy to treat by our device is xanthelasmas. Xanthelasmas are very good to treat because of penetration of plasmatic discharge and penetration of direct current energy and flowing of energy goes direct into the xanthelasma and destroy xanthelasma not only on surface but as well inside. You just treat or coagulate all xanthelasma with our plasmatic discharge and let it for spontaneous healing. Spontaneous healing takes about 14 days, and after 14 days, all xanthelasma is going to be healed. Okay, now I'm going to switch presentation and show you how the device really works, and then we will come back for another indication of rejuvenation, because up till now I have explained you the medical type of treatment, and medical type of treatment is based on golden tip, and now I'm going to show you how the device looks like and how the golden tip looks like. So I'm going to stop presentation. And I'm going to show how how it works. I would like just to for myself enlarge me. So according to device comes as this. This is all device that you need. This is JETT Plasma Lift Medical. The only thing that you need is connection into electric energy. You may see some important parts. This is the golden tip. Golden tip is removable. If you touch your patient, you may put it into autoclave and put it back. Another one part, very important, is the light electrode.
Dr. Baran, we do have in chat that they can't see the presentation. I think everyone can see the screen, but at the top of the GoToMeeting, please choose there from the option of see everyone to see who's talking. If you choose this one, you will see Dr. Baran in a larger size at your screen, and you will see it properly. I think this should be the only possibility what could be wrong. So I think we can then go on.
This is the same issue for me because I would like to see myself bigger.
At the top in the middle.
Yeah, I see it. Definitely.
Just click who's talking, and then you should probably see yourself.
Yes, that's it. So in the middle part, in middle up part of line of this. So once again, I continue. The device is like this. This is very important part. This is our touch screen display. Once you connect device into electric energy, you may see the device is on, and you may see there is a tape. This means that there is no connection for patient. You cannot do anything on display now, and you cannot start to treat with device because it's not working. There is electronic fuse. If you would like to start with device, you need to create connection to patient. The connection to patient is based on two possibilities. First, mainly used possibility is this handpiece, contact handpiece. In one hand is patient, and end of this is another part of the device. You connect it. When patient hold the handpiece, the device is on. When the patient is not going to hold the handpiece, there is no work anymore. But once you hold handpiece, you may start fluently to set level of energy up to the level 8, that is maximum, and then you may set play. Oops. And you may see the device now is on. Once the device is on, you may start to treat, and you will see the discharge between the tip and the handpiece. There is a plasmatic discharge between the tip and the handpiece, and this plasmatic discharge works up to ½ centimeter far from the handpiece. Now it works. Once I go far, it doesn't work, and once I go closer, it works. And once I touch the handpiece, nothing is going to happen. And now I'm going to show how the device work in Apple. But for Apple, I cannot use this because Apple doesn't have any hand, so it could not hold in hand. But this is another possibility how you may connect your patient. You may use it with standard ECG pads. Connect our cable to this ECG pad, and put it on patient, in this case on, I try to find the correct place, on Apple to make a connection, and another part of connection cable back to device. Now the device is not working because Apple is not grounded. But once I hold Apple, it is grounded because I'm connected to the ground, and I may start to treat with this device. I set level on, and I'm going to show you how to work with the device. First of all, I'm going to show you how the plasmatic discharge looks like. Yes, it's half centimeter far, and we do two part of treatment. First part of treatment is scanning. Scanning means that we do this fast movement for all area. You can easily see that device is on by this light, and as well you may see plasmatic discharge. This is part of scanning, the fast movement for all area. And once you finish scanning, you proceed into another part, and another part is dotting. Dotting means that you create small coagulated spots. You stay about 2 to 3 seconds on one spot, and you create coagulation. It is very easy to use, and it is very handy, because in real time you see what you do, and you see that there is only one plasmatic discharge. So this one plasmatic discharge goes only to one spot, or only to one point, and there is active, and then there creates the vertical shape of burn. And what is very important, that plasmatic discharge is effective only if it is there. So if you do this treatment, plasmatic discharge is active. But once you touch your patient, nothing is going to happen. There is going to be no coagulation on spot, because only plasmatic discharge is active, not flowing of electric energy is active according to coagulation. So if you come closer to the body, plasmatic discharge works, and by this plasmatic discharge you can create coagulation. But once you touch the body, nothing is going to happen. This is very, very safe in our device. So this is how to use our device with this golden tip, and what is the usage with golden tip. Now I'm going to show you last part of presentation. Last part of presentation is about completely different use. Different use because we are going to change golden tip to our different tips. It's very easy to remove and connect tips that we are going to use now, or are going to show you, and those are silver tips. We've got cone silver tips, 3 millimeters, 5 millimeters, and as well this flat one. You just connect it to device, and now you have changed device from medical use to beautician or esthetician use. And now I'm going to explain you how the beautician type of treatment works, because this is absolutely different than medical coagulation type, because this is completely non-ablative and completely non-invasive treatment. So once we change the head from golden one to silver one, as you can see on right side, we are prepared for non-invasive rejuvenation. And we need one more thing, and one more thing is active gel. Active gel, you may use our JETT serum lift vital, or you may use any of your gel that you are used to use. What is very important is to use gel that is water-based. And once you start to use our device in contact beautician way, it is the way of treatment when you use active gel and you touch the gel with the tip of the device. Once you touch the gel with the tip of the device, because of polarity, as I have explained you at the beginning, that polarity is that device is negative and body is positive. Because of this polarity, once you touch the gel with golden tip, flowing of electric energy is going from the tip of the device to the body, and because of polarity, it attracts active molecules that are penetrating from gel into the body, into the skin. And final effect is a combination of treatment and active molecules. For example, if you would like to improve hydration and improve metabolism, you use active molecules, you use split hyaluronic acid. If you would like to enhance the metabolism, you may use vitamin C or vitamin B inside of the gel. This is a very important part, that the effect consists of two parts of jet plasma, flowing of energy, and active molecules. This treatment is as well very suitable for enhancing treatment of invasive blepharoplasty. Once you treat blepharochalasis with non-invasive blepharoplasty, in time of healing and contraction of the skin, as I have explained you, this contraction, or retraction of the skin takes about 3 or 4 weeks. In this meanwhile time, you may enhance final effect with usage of this silver tips and offer to your patient some more treatment than only non-invasive blepharoplasty. You may improve final visage, and this is another thing that our competitors are not able to do. Once you use device with alternating current, you cannot do this part of treatment that we call electroporation, this beautician type of treatment. How it looks like if you provide only this beautician type of treatment. It is not long lasting. It is only temporarily, but it means for 24, 40 hours. But what you can see is the improving of hydration of the skin. By improving of hydration, improving of metabolism, you improve the visage. The texture of the skin is more smooth, is more hydrated. And you can use it not only on skin that is very thin, but as well for thicker skin, because electroporation has nothing in common with thickness of the skin. Once you have thicker skin, you use active gel, and active molecules are going to penetrate into the skin as well. So you may use it for face, you may use it for example, non-invasive rejuvenation of a neck. So now, thank you so much for watching my presentation and explaining of how our device works. And now there is a time for your question. If you have any questions according to how to use our device, or what are the indications, or anything that you may imagine, just ask us. We are here, me and Martin as well, for your question open.
Yeah, Dr. Baran, thank you very much for your presentation. And now I will open the chat so that we can see the questions if there are any. Yeah, there came a question. How long does the process take for blepharoplasty?
Yep. Proper treatment, as I have shown you on Apple, the dotting, scanning, and the dotting. The proper treatment is quite fast, about 5 minutes for one eye. But you need to count as well the preparing. Preparing means cleaning, disinfection, local anesthesia, connection to patient with device, and so on. So finally, it takes about half an hour up to 45 minutes for both eyes, for upper or lower eyelids. So about 45 minutes, let's say.
Thank you. I don't see any other questions so far. If there is any, I would say that could be end of our presentation. Thank you very much for participating in today's webinar. If you have any questions also after this webinar, please feel free to contact us, and we will answer your question also afterwards this webinar. If you have any questions to the device, please contact your local distributor who probably invited you to this webinar, or contact us, and we will provide you with the information who is your local distributor. So thank you very much for participating. Have a nice evening or afternoon, depend on the place where you are now. And thank you, Dr. Baran, for your presentation.
Thank you, everybody, as well. Good heal and good time in this COVID era. And stay safe and stay in touch with our device and enjoy JETT Plasma Medical. Thank you so much. Good evening.
Thank you. Bye.